Anabolic steroid use and the psychological effects. Anabolic androgenic steroids, commonly known as anabolic steroids, are synthetically derived from the predominant male sex hormone testosterone, which is modified to enhance anabolic actions such as protein synthesis and skeletal muscle growth. Testosterone is the sex hormone that stimulates the development of male sex characteristics and growth of muscle and bones. This hormone is produced in the testicles and also in the ovaries in women, but in smaller amounts. Anabolic steroids are used predominantly for the male physique and athletic performance. However, AAS can also be used in cosmetic, therapeutic, and occupational settings. Individuals who use anabolic steroids for therapeutic reasons use it as an improvement to their quality of life. These are people such as HIV patients and diagnosed depression patients. This drug is often illegally administered by individuals to increase performance, fat-free mass, and muscle strength. Anabolic steroids can be administered orally or by intramuscular injections. To reach high dosages and rapid effects, steroid users practice a method known as staking, which is the intake of 2 or more steroids in high dosages, whereas pyramiding is a progressive increase of the steroid dosage, beginning with a low dose cycle, increasing gradually over the 6 to 12 weeks and slowly reducing the dosage to 0. This slow reduction to 0 decreases the dependency the individual has when off steroids, whereas if the dosages are reduced rapidly, individuals feel the need to stay on steroids. Although anabolic steroid use is generally looked at in a negative way due to the media, research has shown that there are some positive psychological effects of its use. However, finding research on the positive effects of anabolic steroids has been limited, as many articles focus on the negative effects of anabolic steroids on the individual. The use of this steroid can positively affect the muscle mass, strength, and the perceptions of positive well-being an individual has whilst using the drug. Reports from numerous AAS users have shown that the steroid increases their perceptions of self-confidence, self-esteem, invincibility, and in some cases, academic performance. Many articles refer to aggression as a negative psychological effect of AAS use. An article by Mazzio et al. Had a different perspective on this. This article looked at aggression as a way of making an individual have a more determined attitude, predominantly in sports where physical contact with the opponent is required. It was also found that the use of anabolic steroids positively affected the individual's mood changes, euphoria, increased energy levels, and enhanced libido. Anabolic steroid use affects the amount of hormones that are released within the body, such as serotonin and dopamine. Due to the increased levels of dopamine within the body, similar characteristics to the effect of amphetamines can be present, meaning that anabolic steroids initially act on the intellect by stimulating the increase of dopamine production. This then results in the users having a sense of euphoria when initially using AAS. This provides the individual with a state of wellness, happiness, and helps them to maintain focused and motivated during workouts without feeling fatigued. However, this then leads into the negative effects of anabolic steroid use, such as dependence on AAS and other psychological effects. Mazzio et al. States that over time the original feeling of euphoria when first using AAS can turn into aggression or antisocial behaviors. Anabolic steroid use can also have many negative behavioral effects on an individual, such as irritability, emotional liability, hostility, and anxiety. There are many negative psychological effects associated with anabolic steroid use. Some of the psychological side effects of anabolic steroid use include alteration to libido, sleeping issues, increased fatigue levels, suicidal thoughts, and an increase in aggressive behaviors. An article by Kanayama et al. States that prolonged use of AAS can lead to many psychiatric effects such as dependence syndromes, mood syndromes, and progression into other forms of substance abuse. In addition to this, the feeling of dissatisfaction or depression associated with hypogonadism can encourage previous AAS users to resume taking anabolic steroids. AAS was found to increase B endorphin in the brain area, which is thought to lead to the development of dependence. Anabolic steroids act on the regions of the brain which control drug dependence, therefore leading to the dependence of anabolic steroids. This can require treatment to reactivate the neuroendocrine function, and antidepressants treatments for individuals who suffer from depression and are non-responsive to endocrine therapies alone. However, it is still unclear as to whether anabolic steroid use is responsible for these psychiatric effects, or if personality traits contribute to this as well. It has been proven that anabolic steroid users are often dissatisfied with their body and have low self-esteem. This dissatisfaction can lead to muscle dysmorphia, and as an expression of a form of body dysmorphic disorder. This syndrome refers to individuals who believe they have a small, disproportionate body and are pathologically preoccupied with their amounts of muscularity. From this, it can make the individuals more susceptible to have withdrawal symptoms and resume use of anabolic steroids. Recent clinical data shows use of anabolic steroids could also exert beneficial effects on muscular dystrophy and several dermatological diseases. However, as there has only been a small number of investigations, whether or not AAS can be used to treat these conditions is yet to be confirmed. It can be concluded that anabolic androgenic steroids have both positive and negative psychological effects on an individual. Users face a number of both physical and psychological health problems. However, the use of AAS is still a growing public health concern. Users seeing positive outcomes such as having larger muscle mass, increased muscle strength, and perceptions of positive well-being has a positive effect on the individual's self-esteem and can have a major effect on the perceptions towards anabolic steroid use. These positive outcomes can lead to many negative effects from prolonged use, such as depression, anxiety, suicidal thoughts, aggression, dependence, and more. Furthermore, when looking at anabolic steroid use, it can be seen that there are both positive and negative psychological effects.